Hello, my name is Jessica Brooks, and I am videotaping this video for medication administration for Excelsior University. Today, I will be demonstrating oral medication, sub-Q, and IM. So, we are going to begin with basically explaining what we have on the table here. So I have my sterile field here. I wouldn't really touch this if I had gloves, by the way. I kind of knocked that over on accident. I'm just going to move this over. But we have ID band, we have gloves, we have hand sanitizer, we have the medication vials, we have the syringes, we have needles, and we have alcohol padding. We have the linen, and then we have the makeshift sharp container. So, pointing out the materials. Before I would begin anything, I would make sure that I do hand hygiene. I did explain that the supplies that we have are available. I would go to the patient and let the patient know what I am doing. I would verify her allergies. I would verify her by her ID band, which is her name is going to be Millie Larson. She's able to verbalize that her name is Millie Larson. She's able to let me know she obviously has no allergies. She verbalized to me that her birthday is January 1st, 1936. I will explain to her that I will be giving her insulin because her blood sugar is up, so I'd be giving her 10 units of the Liz Pro. And I would also be giving her the haloperidol to help her feel a little better so she's not so agitated. And I would also be giving her the Docosate, so that would help her soften her stools so she can go easier. This is also the MAR. I will go and verify the medications for the first time against the MAR. So we would verify that this is indeed the Docosat 100 milligram, and it does show that this is indeed the same medication. We will go on and identify that this is the Liz Pro 10 unit, and it goes against the MAR also, that it's the same. And this is the Haldol, and we would verify also that this is the Haldol, which is 2 milligram. So with that, this would all actually stay in the sterile field. We're not gonna, this is my clean section here. So the Haldol, it does match up as the 2 milligram. Docosat matches up as the 100 milligram, and the insulin matches up as the 10 units, Liz Pro. So we are going to wash the hands like I said. We have our barrier, we have our equipment. We are going to make sure the medications are not expired. So the medications will say 6/20/2026, which it is not expired. And the expiration date would be the same for the insulin and the haloperidol as well. So we know now that the medications that we are giving are not expired. So we have all the medications selected that are ordered using our MAR. So that was our second check. So now, Miss Millie, I will be giving you your Docosat. So we've already performed hand hygiene. So we would, and here's the medication cups here. So we would give 100 milligram pill of the Docosat, and we would give the medication. I would touch it here, but I would give this. Here you go, Miss Millie. Here is your 100 milligram of Docosat. Okay, she has the 100 milligram of the Docosat after the second verification against the MAR. So now we will do our subcutaneous injection. We will use the insulin needle here. This is sterile, so I would be putting on my gloves. So this is the insulin needle here. So she is due to get 10 units of Lispro. So we're going to take out the insulin needle for her Lispro. So we would make sure that there is no air in the syringe. So we will pull back what the volume would be, which would be 10 units. So we would pull back the volume up to the 10 units. So there's the 10 units. If this were already uncapped, we would take an alcohol pad and wipe it. But since this is actually capped, we don't have to use the alcohol wipe to wash it. But for the sake of this video, I will just wipe it with the alcohol pad anyway. I will invert. And we're going to place this here. And I will inject the 10 units of air in to make sure there's no air in there. And then I would draw back slowly to make sure that the dosage is accurate. Make sure there's no air bubbles in there, which it is not. So here we are at 10 units. There's 10 units there. So here is the line, well, the lemon here, I'm sorry. Here's the lemon. So we know that this is 10 units of Lispro. This is the Lispro. Miss Millie, I'm going to give you your 10 units of Lispro. So we have verified once again this is the right medication. And the syringe would also be labeled as a sub-Q syringe, as we stated on the package there too. So we would take this, and since this is a sub-Q, we can go 45 to 90 degree angle. We'll take it here. If this was on the person per se, we would go in a fatty area for Miss Millie. So what we would actually do is pinch the subcutaneous part, like behind the arm. So we would really go behind the arm and we would just pinch, and we would get to where we can get into the fat, and we would just inject in, and we would just give the injection, come out, safety needle, and we would put it into the Sharps container there. So we have completed the subcutaneous injection for the insulin. We will take these gloves off. We would perform hand hygiene because we will be giving another injection, so we must perform hand hygiene between every injection and procedure that we do. I also would have performed hand hygiene after giving her our oral medication as well. So now we are preparing for the IM. So this would be the Haldol here. So I would have put the, like I said, between each procedure before putting on the gloves, we would use hand sanitizer. I'm actually using it this time. So hand sanitizer here. Once I've used my hand sanitizer, I can put on my gloves. Let me see, where's the gloves? So I would put on my gloves. And we're going to prepare for the intramuscular injection. And obviously, too, I meant to mention before I give the injection, I would have used the alcohol pad to wipe and then give the injection. So now we're doing the IM injection, and I also would have I would have made sure I would have drew back too before injecting to make sure that there's no blood coming, and then if there's none, I can proceed with the injection as well. Saying this is for the IM. So I would take the alcohol pad this time as well, and I would wipe before I do the IM injection. We would say that I locate the greater trochanter in the lateral femoral condyle. I place my hand pretty much like above, we're going to say this is above the knee, and at the greater trochanter. This would be like a triangle, and in the middle of that triangle, that would be my injection site. This would be my point of injection. So with that being said, we will once again check against the MAR. We would make sure that this is indeed the Haldol, which it is. So we are saying that this is the haloperidol, 2 milligram. Once the math has been done, to make a long story short, that would actually be 0.4 ml if we were to inject. And this is actually a 0.4 ml, 2 milligram for the Haldol here. We're going to again verify it against the MAR to make sure that it is correct, and it is. This is indeed the haloperidol. We will remove the needle. A 22 gauge needle would be appropriate for this, and we do have a 22 gauge needle here. We would go on and screw this needle on. This is the needle. So we would pull back, and we would go into the vial, and we would go on and actually this is going to be the 22 gauge. This is the 22, I'm sorry. And we'll go into the vial here. We will wipe it off with the alcohol swab here. We'll say this is the Haldol. And throw it in my makeshift trash here. We'll remove the needle. We will draw what would be the 0.4. I'm going to go to 0.4 there. I like to go through the mud. I start off with a weak ass character, get peeled. So this is build my nigga up, okay, let's recant that. I'm a little nervous. So actually what I would do is I would draw it to the actual 4 ml, well, the 0.4 to make it my 2 milligram. We would draw the air, and then we would inject the air back in here. We would inject it back to make sure there is no air, and then we would draw back that actual dose here, which is her 2 milligrams, the 0.4 ml there. All right, we would, as I mentioned, we'll make the triangle. We have located our point of injection there. And we would wipe again with alcohol swab. We would take the needle and we would inject it at a 90-degree angle. We would just quickly inject, and we would remove. We cap the needle into the sharps container. I would remove the gloves. I would again sanitize my hands. And this was the Haldol that was given for this medication here. We would go on to say So here's the MAR here. And we will go on to say that while doing the injection, like I said, I would have located the greater trochanter in the lateral femoral condyle. I would have placed my hand above the knee and at the hip, the trochanter, made a triangle, and my X is in the middle there, and 90-degree angle, and we're there. So I would have basically also held the skin taut with the non-dominant hand, and like I said, 90-degree angle, and the injection would have been a slow injection, but I could, withdraw so it's not, too painful for the patient. And like I did, I removed the needle, capped the needle, sharps container. I would actually take the gauze here while I still have my gloves on, and I would have applied some pressure there to make sure, there's no bleeding. And I would have took the Band-Aid here. I do have a Band-Aid. Would have took the Band-Aid and put the Band-Aid on and reinforced it with the gauze as well to make sure there's no excessive bleeding. So I remove my hands, I perform my hand hygiene. I would record my medication administration that I have done, and I would make sure that I document it, and I would record the patient's tolerance if they were able to tolerate it well, perform hand hygiene, and I would exit the room. Thank you. Probably gonna do